First aid is a great skill to have when it comes to small and large crises, but not knowing how to do it correctly can do more harm than good. First aid is meant to do three things: preserve life, prevent further harm, and promote recovery. First aid is really as easy as ABC: airway, breathing, and circulation. Make sure the airway is clear. Once the airway is clear, determine whether the person can breathe. Check her pulse, and if the person is not breathing and there is no pulse, go straight to CPR. One of the most important things is knowing CPR. There are a few steps to CPR, but first and most important is to call 911 or tell someone to call 911. And this goes for any crisis, not just CPR. There are two main steps to CPR: chest compressions and providing breathing. The first aider should kneel next to the injured person, who should be laying on their back. For adults, place the heel of one hand in the middle of the chest. Take the other hand, put it on top, and interlock your fingers. Push down on the chest 1 to 2 inches and wait for the chest to come up completely before you do more. You must keep your elbows completely straight during this whole process. Okay, so give 30 compressions and then give 2 breaths. Make sure the airway is open and gently pinch the nose. Raise the chin upward, take a deep breath, seal your mouth with the person who is injured, and exhale into the airway. Make sure the chest rises and falls. Repeat this again. Breath, breath. Keep repeating this process until an EMT or medical professional arrives on the scene. Note, if you are going to do CPR, you should have your certificate, but if it's a matter of life or death, just do the CPR. Another big part of first aid is wounds. When someone is bleeding, you want to prevent as much blood from leaving their body as possible. Find a clean bandage or cloth and apply even pressure for 20 to 30 minutes or until the bleeding stops. Clean the wound out by gently running it under water. Do not use soap. Apply an antibiotic to the wound like Neosporin. And finally, cover the wound with a bandage. Some random first aid things you should definitely avoid. Tilting your head back during a nosebleed. Tilting your head back during a nosebleed will make the blood go down your throat, and that is not good. So what you should do instead is pinch your nose and lean forward. Forcing a person to sit up after they just fainted. If someone faints, the first thing you should do is check their pulse and breathing. If that's okay, raise their feet 12 inches above the ground and just let them chill. Do not make them sit up after they have just waken up. This might cause them to faint again. Putting heat on a fracture or sprain. Heat will increase the blood flow, which will ultimately increase the swelling. Instead, put ice on this kind of injury. This will reduce the swelling, bruising, and muscle spasms. Don't place the ice directly on your skin. Leave it on for at least 20 minutes. Pulling out debris from your body. Do not pull out debris from your body. If you are not using sterile tools and you do not know the depth of the wound, you are at risk of infection. Instead, you should use sterile tools or seek out medical help. These are just a few rundowns of some basic first aid skills. I highly recommend you learn more about first aid so you can save life, because it's always a beautiful thing to save lives. And no, I did not get all of my information from Grey's Anatomy, just most of it. Kidding.